Good morning, everybody. My name is Dylan Snowden, and I'm representing Arthrex. I'm here today to brief you on what healthcare professionals are now calling the new standard of excellence for Lapidus procedures. My goal today is to inform you all on how Arthrex is improving the lives of their patients. Since 1981, it's been our mission to do this, to help surgeons treat their patients better. And today, I hope, in fact, you can see that we are truly doing that. Now, one of the most common approaches surgeons use to address hallux valgus is dorsal Lapidus plating. Now, the dorsal Lapidus plating is great for dorsal compression on that dorsal aspect of the bone, as well as medially. It gets good compression, but not so much on the plantar side. You see, in the push-off phase of your gait, on the plantar side, it actually opens up. We know that this is called plantar gapping, which ultimately results in non-union. Now, what if we were to put a plate on the plantar side of that foot? Then, in return, when in the push-off phase, those forces that were once going away from the joint are actually now coming into the joint. So, at Arthrex, our surgeons and engineers, we came together and they said, what do we have on the market right now? What is our market looking like? And they came to a conclusion that they were at about a 90% success rate. So 9 out of 10 people were leaving the doctor's office and not having to come back. Most would say that's pretty good. But we at Arthrex are worried about that one person. We are worried about finding a solution for that one person. So in fact, that's what we did. We said, how can we make this better? So we said we need a solution that provides optimal compression across the whole joint all the way through the gait cycle. So that actually leads me to Arthrex's plantar Lapidus plate. This plate is fixed on the proximal and distal end with 2 locking screws, and this has 2 features. The first feature being that it is plantarly fixed. That's key. The second one is that it has a compression screw. Now, these 2 features are going to bring value in enhanced patient outcomes as well as lower chance for revision. Now, that first feature that I want to talk about is the plantar fixation. In an article in 2018 in the the Journal of Orthopedic Surgery and Research, Dr. Burchard actually finds that most Lapidus procedures actually fail due to lack of compression on that plantar side, resulting in a non-union. So the benefit that this does is it provides compression all the way through that gait cycle. So like we talked about earlier, those forces are coming into the joint, and that is key. The value for this is less chance for revision and improved patient outcomes. Now the second feature is that compression screw. In an article in 2019 from the Diabetic Foot Journal, Dr. Russell actually states that compression screws do a great job of adding compression. In fact, 92% of the time they are successful, which is key for this. So along with the plate, adding a compression screw, we're getting optimal compression there. So we're getting compression all the way through the joint. That means dorsally, medially, as well as plantarly, and that is key for union to take place. The value this gives is enhanced patient outcomes as well as less chance for revision. Now, 3 additional features that this product brings is a minimized profile, an optional drilling guide for that compression screw, and it also comes in 2 different sizes for both left and right plates. In summary, I think that, and we believe at Arthrex that the feature that it has of being planted on the plantar side, as well as that, in addition to that compression screw, that we're going to see better patient outcomes, and also there's going to be a less chance for revision. So Arthrex is a company that we are fighting for that one person. We are fighting for that 10%. Initially, we had success rates with our hallux valgus deformities of 90%, but we said that's not okay. We can do better. We're a better company than that. So what did we do? We created a new solution. And now our success rate went from 90% all the way up to 96%. At Arthrex, our goal is to put the best solutions in front of healthcare professionals like yourselves. So thank you for having me today. Again, my name is Dylan, and I'll be in the back to answer any questions, and we'll also be having a Sawbones lab if you would like to get your hands on this technology. Thank you so much.